First, you must know your anatomy well enough in order to bring the structure into an accessible position. For instance, on the shoulder, if you want to work on the supraspinatus, you need to know that the arm must be behind the back in order to touch the supraspinatus tendon. If you're going to work on the elbow, you need to be able to have the hand supinated, or else you can't find the tendon attachment. So for instance, in this position, you can find the attachment of the tendon. If the hand were this way and pronated, you could not. When you're working on the knee, if you're trying to do the coronary ligament, for instance, if you lie down for just a moment, you have to know that the knee must be bent and the foot must be turned out to get at what's called the medial coronary ligament. Second rule is you have to have no lubrication. The person has to have dry skin. Otherwise, your body will it'll move. Your fingers will just move over the skin and you won't be able to create the friction necessary to break up the scar tissue. You also work perpendicular to the structure. So for instance, in this position, the medial collateral ligament is going in this direction. If I were going to work on it, I would have to work up and down, up and down. Another guideline is to apply the pressure in one direction only. So here, if I'm pressing, I'm going to use pressure up, relax down. Use pressure up, and rest on the return stroke. This way, I don't get my hands tired and I don't irritate the person too much. I'm doing a controlled kind of irritation to the ligament to break down the scar tissue. Your fingernails must be very short so that as you touch the person, your nail does not touch them and give them pain. When you're working, you want to use different parts of your hands because you don't want to get tired and strain yourself. You can use the tips of your fingers, you can use your thumbs, you can use what we call reinforced fingers, either by doing something like this or having another finger on top of the finger that you're using. And frequently change positions. For instance, if I were working on the coronary ligament, I would work in this position for a while, and then later I would probably work with my thumb. Sometimes you can actually move the client's body instead of your hand. And when you move your hand, always move your entire hand. Don't just move your fingers back and forth, then you'll strain yourself. If you use your entire hand to go back and forth, then you will not be tired. Everything should move, not just your finger. So if I wanted to work on the psoas muscle, instead of using my hand way deep in the abdomen on the spine, I would find the psoas muscle, I would apply pressure, and then I'd put my hand on the thigh, just above the knee, and I'd roll the leg. This makes the psoas move, so that I'm working on the psoas itself, up in the spine, by moving the leg. One other important guideline, the skin must move with your finger. So if I'm working on the medial collateral ligament, I'm going to move the skin with me and relax back. I'm going to move the skin with me. If you do not do that and you rub against the skin, you're going to tear the skin after doing this for 4 or 5 minutes, and the person will get a big scab and think you've hurt them. So you must be careful to keep your finger planted and only move as far as the skin moves, and you will often snap across a ligament or a tendon. We always press against a bone when we're doing friction. We're not out in the air somewhere. We have to press against a bone. And the client must be in a comfortable position. For instance, if I were going to work on her biceps, if you'd sit up, I'd combine two things. I'd make sure she was comfortable. Are you comfortable? And I would put my finger on the biceps, and then I would do a motion that would be comfortable for me and her. I'm on the biceps tendon, and I'm snapping through it without using pressure from my finger. I'm just staying stationary, and I'm snapping through the tendon. So if you follow these guidelines, you won't hurt yourself, and you'll help your clients.
Some of you may not be aware that there are many other webinar series available on demand on the Ben Benjamin website. You can order recorded webinars, and they come to you in just a few minutes. You'll see a list of our webinar series featuring presenters Ben Benjamin, Tracy Walton, Whitney Lowe, Tom Myers, Carol Osborne, and many other experts in their fields. There are also a few free webinars available. Visit benbenjamin.com for more details. Also, if you would like more information about upcoming courses and to receive free gifts including an exclusive ebook on low back pain, visit benbenjamin.com and join the mailing list.